Today, I want to describe one of the most misunderstood herbs in Chinese medicine, in herbal medicine, Gardenia, Zhi Zi, because to my knowledge, after 10 years of traveling all around the world, all across Asia and America, Europe, with the so-called great practitioners, I've never met anybody that can actually correctly identify this herb and use it in a clinical setting. So yesterday in the clinic, somebody brought in this well-known commercial brand capsule, and it was used for insomnia because it had the herb gardenia in it. And because of that, I couldn't sleep last night, because it just frustrates me what little understanding people have about herbs, because the very nature of its herb is toxic, so its flavor pertains to its toxicity. Ancient medical doctors used to gather herbs, collect herbs, and prescribe herbs knowing that they have a toxic nature, because its toxicity is very important, because it causes a reaction in the body which is balanced out by very specific signs and symptoms to clear an obstruction to restore natural function. All herbs have a framework to identify them. It's very important. And in the case of Gardenia, Zhi Zi, you always have this thick yellow tongue coating with this fluorescent yellow. Your urination is always yellow. You always have some stickiness, so some sticky soft stools. You always have engorged blood vessels beneath the eye, and you have this contraction under the diaphragm. It's like a V contraction under the heart that is non-responsive. Because when there's a contraction under the heart, it puts pressure on the heart. Because what you need to understand is when the heart pumps the blood, 2/3 of the blood moves to the small intestine. And if there is a contraction or locking on the diaphragm, it puts pressure on the heart, increases the heart rate, which causes the body fluids to overheat. And that is why you manifest with this yellow, fluorescent yellow tongue coating, yellow urination, sticky soft stools with an odor, engorged blood vessels beneath the eye, because the body is starting to overheat. And when it overheats, this is where you can get these secondary indications like insomnia or general aches and pains, anxiety. And then you can start breaking it down accordingly, because ancient formula structures are perfectly dosed and measured. You should not add herbs or subtract herbs. You should not need to modify herbs when you're not chasing disease names or looking at obstructions and what is inhibiting natural function. It's very important for people to understand that herbs are toxic. We're prescribing toxic herbs to create a reaction to restore natural function. And with these ancient formula structures, with Gardenia Zhi Zi, there are 9 of them. But knowing that there's 9 formula structures, each formula structure has individual herbs and dosages, so then you can start breaking your patterns down, because everything is a formula disease pattern. A primary indication aligns with a herb, and then when you get these set of primary indication, each will always align with a specific herb and dosage, and that's why relationships of herbs are very important. And when we're looking at these 9 formula structures, 3 of these formula structures have thirst, because Zhi Zi Gardenia does not have thirst. But when there is thirst, you can consider 3 formula structures. 2 of the formula structures have a herb called huangbai, but one of those formula structures within that 2 has a herb called mengxiao. Mengxiao always presents with this large plate shape with edges in the upper epigastrium, because the fluids are becoming obstructed, they're becoming congealed. And if you're looking at the other 6 formula structures, they are also easy to break down and identify. If there is abdominal distension, wind and bloating, you can consider the herb hopul, and that is when you get abdominal distension that feels soft. If it feels tight and the skin is dry, then you consider ganjang, dried ginger, and that just means the body fluids are not warming, metabolizing properly, and then you'll start to get frequent urination or spitting or salivation or nausea or vomiting with fluids. Like every single herb within a formula structure needs to be identified, and that's how we restore natural function. And this is why we can actually understand herbs according to these primary indications and secondary indications. Because once we identify a primary indication, then we can consider these secondary indications like insomnia. Because with insomnia, there's so many ways that this can manifest. Because as soon as there's pressure on the heart, you increase the heart rate, it causes restlessness, anxiety, insomnia. But if there is a bowel obstruction, so if there's constipation or dry hard stools, you get responsive discomfort in the upper epigastrium. And when it is severe, it starts to create this shape in the upper epigastrium that feels responsive. And because there's an obstruction in the upper epigastrium, it puts pressure on the heart, increases the heart rate, causes vexation, agitation, insomnia. If you're not metabolizing fluids properly, you start to get pulsations under the umbilicus, and then when it comes up into the upper epigastrium, you'll start to feel splashing, so you'll hear sounds of water sitting under the heart, and that puts pressure on the heart, and that causes anxiety, palpitations, and insomnia. If somebody's stressed or anxious and it causes the blood vessels to vasoconstrict, it puts pressure back up onto the heart, and that creates insomnia. There's so many variables as to why you can have insomnia, and the role of a herbalist or a medical doctor is to understand the why, and then you can prescribe the correct herbs accordingly, and then you can restore natural function and basically create harmony again. And if you start understanding and prescribing herbs in this manner, and you're not just guessing, so you're not modifying or throwing herbs at disease names. If you do that, what's the difference between Western medicine and Chinese medicine or herbal medicine? There's no difference if you start using herbs according to names of infertility or skin problems. It makes no difference. You need to understand why the body is presenting in this manner, and that is what will separate you from guessing and having hit and miss results compared to actually being able to reproduce your results and have confidence in the herbs that you're prescribing.